Welcome to Healthcare Today. There are tremendous innovation and improvement in orthopedic care, from plaster, traction to surgery. Nowadays we are doing surgeries for almost every condition of orthopedic problems, but nonetheless still we are using plaster technique for lot of our orthopedic problem to treat our patients. Unfortunately, still we can found few of the conditions the concept has changed, but in some part of our country or some part of areas patients have been treated with plasters. Today I will tell you for a foot and ankle where you don't need any plaster treatment and how the concept has evolved. Even during my training time, I used to apply plaster cast for all the tissue injuries, soft tissue injuries of the foot like sprains. But nowadays, all the sprains, they don't need any plaster cast immobilization. We want them to move their foot and ankle and every joints as early possible with simultaneous protected weight bearing, and that we are doing with pneumatic air boot. Even some of the fractures we are not applying any plaster cast, like the fracture of a small bone, we call it fifth metatarsal base. Pneumatic boot, it has replaced the requirement of plaster cast for many of the fracture cases also, like a undisplaced fracture of the ankle can be treated with a pneumatic cast boot and we don't need any plaster. This has given our patients a great relief, because remain in plaster for 6 weeks and 8 weeks is not so easy. A country like India where the summer is very sweaty and hot, humid, the persons who are under plaster suffers a lot from itching and the skin condition gets deteriorated within the plaster. Even if you need plaster for some reasons, you should aware of few things that is must to avoid any catastrophe with the plasters. The most important thing, avoid swelling, because the plaster, the limb is in a closed chamber. If there is a more swelling, the tissue will compress, circulation will compromise and your limb can be in danger. So after plaster, if you have excessive pain, excessive swelling, or tip of the finger, toes, they are discolored, you should report your doctor immediately to avoid any catastrophe. These are very emergency. Non-emergency problems, due to itching, everyone tried to poke inside the plaster with some stick, scale or anything, a metal stick. That is very dangerous. That can cause skin injury inside, will remain unnoticed and can get infected. Whatever happens, do not poke inside the plaster. Do not allow water to seep inside into the plaster. If the water goes in and it remains soaked, wet, fungal infection will happen and skin maceration will happen. That is also a difficult things to treat after removing the plaster. For a lot of cases we don't need plaster, can be treated with other ways like pneumatic boot, which is very comfortable for the patient. And even if you require plaster, you should be careful that there should not be any harm happening with the plaster. We care for you.